There is something that happens to almost every senior who starts experiencing shoulder pain, and it is the single biggest reason the problem gets worse instead of better. It is not a medical mystery. It is not bad luck. It is a pattern that repeats itself millions of times, and most people never realize they are doing it. When your shoulder starts hurting, your brain does something automatic. It starts avoiding the pain. You stop reaching overhead. You switch which arm opens the car door. You let your spouse grab things from the top shelf. You sleep only on one side. You stop lifting your arm past a certain point because you know what happens when you do. This feels like you are protecting your shoulder. It feels responsible. It feels like you are being careful while you wait for the pain to go away on its own. But here is the truth that most people discover far too late. Every time you avoid using your shoulder, the muscles that support it get weaker. Every week you limit your movement, the joint loses more of its range. And every month you adapt around the pain instead of addressing it, the mechanical problem that caused the pain in the first place becomes harder to reverse. What feels like caution is actually acceleration. You are not protecting your shoulder. You are slowly shutting it down. This is why so many seniors go from occasional discomfort to chronic limitation in what feels like no time at all. The pain did not suddenly get worse. The shoulder was silently losing function while you were busy avoiding it. A large clinical review published in 2022 followed adults over 60 who experienced persistent shoulder pain for more than 6 months without targeted intervention. The findings should concern anyone who has been waiting for shoulder pain to resolve on its own. Those individuals lost an average of 35% of their functional arm strength during that period. Not just mobility, strength. The muscles that should be holding the joint stable were wasting away because they were no longer being used. But here's the part that matters most for you right now. The same research showed that seniors who addressed shoulder pain with the right targeted exercises, not just general movement but specific corrective work, were able to recover most of that lost function even after months of decline. The shoulder is remarkably responsive when you give it what it actually needs. And today, that is exactly what I am going to show you. By the end of this video, you will understand exactly what is happening inside your shoulder that creates pain after 60. You will know why the advice to just rest it or take it easy often makes the problem worse. And you will have 5 specific exercises that address the actual mechanical causes of shoulder pain in seniors. These are the same movements I use with my own patients to restore pain-free function, often within weeks. But before we go any further, I want to hear from you. If you have been dealing with shoulder pain that limits what you can do, whether it is reaching overhead, getting dressed, or sleeping through the night, let me know in the comments below. Tell me how long it has been going on and what daily activity it affects the most. This helps me understand what you are dealing with, and it helps me create content that actually serves your needs. Now let me explain what is really happening inside your shoulder, because once you understand this, everything else will make sense. Your shoulder is not like your hip. Your hip has a deep, stable socket that holds the leg bone securely in place. The shoulder is completely different. The socket is shallow, almost flat. If you imagine a golf ball sitting on a tee, you have a reasonable picture of how your shoulder joint is designed. This shallow design is what gives you the incredible range of motion your arm has. You can reach in almost any direction. You can rotate, lift, extend, and move freely. No other joint in your body has this kind of mobility, but that freedom comes at a cost. Because the socket is so shallow, your shoulder depends almost entirely on soft tissue to stay stable. Muscles, tendons, and ligaments are doing the work that bones do in other joints. When those soft tissues are strong and balanced, the shoulder works beautifully. When they are not, problems begin. After 60, 3 things typically happen that change shoulder mechanics. The first is postural shift. Decades of reaching forward, whether from driving, cooking, reading, or working at a desk, cause the muscles at the front of your body to shorten and tighten. This pulls your shoulders forward and changes the position of the joint. The second is muscle imbalance. The muscles at the back of your shoulder and between your shoulder blades weaken from underuse. They can no longer counterbalance the forward pull, so the shoulder blade tips forward and alters how the joint moves. The third is rotator cuff weakness. The rotator cuff is a group of small muscles that hold the ball of your arm bone centered in the socket. When these muscles weaken, the ball shifts position slightly with every movement. It drifts upward and forward, and suddenly there is friction where there should be smooth gliding. that catching sensation you feel, that sharp sting when you reach certain ways, that ache that wakes you up at night. These are not signs of a worn-out joint. They are signs of a joint that has lost its mechanical balance. And that is good news, because mechanical problems respond to mechanical solutions. Before we get into the exercises, I want you to try 2 simple tests with me right now. These will show you exactly where your shoulder is starting from. For the first test, stand or sit comfortably. Now, try to reach your right hand behind your back and touch your left shoulder blade. Do not force it. Just notice how far you can go before you feel tightness or discomfort. Then switch sides. Left hand reaching for right shoulder blade. Is one side significantly tighter than the other? Is there pain on one side that is not present on the other? For the second test, stand facing a wall about 6 inches away. Place both palms flat against the wall at shoulder height. Now slowly slide your hands up the wall as high as you can while keeping your palms in contact with the surface. Notice where you feel restriction. Notice if one arm stops lower than the other. Notice if there is pain or catching at a certain point. These 2 tests reveal a lot about your current shoulder function. If you felt significant tightness, limitation, or difference between sides, your shoulder is telling you it needs attention. The exercises we are about to cover address exactly what these tests reveal. The first exercise targets the tightness at the front of your body that is pulling your shoulders forward. This is where we have to start because no amount of strengthening will help if the joint is locked in the wrong position. You will need a doorway or a corner where 2 walls meet. Stand in the doorway and place your forearms on either side of the frame. Your elbows should be at shoulder height, bent at roughly 90 degrees. Keep your chest lifted and your spine straight. Now step forward through the doorway until you feel a stretch across the front of your chest and the front of both shoulders. Hold this position for 30 seconds. Breathe deeply and let the muscles release. Then step back and rest for a moment before repeating. The key is to perform this stretch at 3 different arm heights. First with elbows at shoulder level, then with elbows slightly higher toward the top of the door frame, and finally with elbows slightly lower toward waist height. Each position targets different fibers of the chest and shoulder muscles. Together, they create comprehensive opening of the entire front body. Research published in the Journal of Physical Therapy Science found that seniors who performed this type of pectoral and anterior shoulder stretching daily for 4 weeks showed measurable improvement in shoulder posture and a significant increase in the space within the shoulder joint where tendons glide. More space means less friction. Less friction means less pain. Perform this stretch 3 times daily if possible. Morning, afternoon, and evening. Each session takes less than 2 minutes, but creates meaningful change over time. Now that we have started opening the front of the body, we need to activate the muscles at the back that have become weak and dormant. This is where the second exercise comes in, and it targets a muscle that most seniors have never specifically trained. The lower trapezius runs from your mid-back up toward your shoulder blade. When this muscle is strong, it anchors your shoulder blade flat against your rib cage and prevents the forward tilt that causes so many problems. When it is weak, the shoulder blade tips forward and the entire joint shifts out of alignment. To perform this exercise, lie face down on a bed, couch, or mat. Let your arms hang off the edge at roughly 45-degree angles from your head, forming a Y shape. Your thumbs should point toward the ceiling. Now, without lifting your chest, raise both arms toward the ceiling as high as you comfortably can. You should feel the muscles between and below your shoulder blades working intensely. Hold at the top for 3 seconds, then lower with control. This is not about how high you can lift your arms. It is about feeling the right muscles engage. If you feel strain in your neck, you are compensating. Lower the height and focus on the squeeze between your shoulder blades. Start with 8 repetitions. Work toward 12. Perform this exercise daily. Over time, you will notice that your shoulders naturally sit further back throughout the day because the muscles holding them there have regained their strength. And this brings us to the third exercise, which builds on what we just did by targeting the muscles between your shoulder blades directly. This is where posture correction becomes permanent. Not something you have to think about, but something your body does automatically. If you are finding this helpful so far, take a moment to hit the like button. It helps this video reach more seniors who need this information. And if you know someone over 50 who has been struggling with shoulder pain, share this with them. It could change how they approach the problem entirely. Now let us continue with the third exercise, which directly strengthens the muscles between your shoulder blades. These are the muscles that hold your shoulder blades in proper position throughout the day. When they are weak, your shoulders drift forward no matter how much you try to sit up straight. When they are strong, good posture becomes automatic. For this exercise, you will need a resistance band. If you do not have one, I recommend getting a light to medium strength band. They are inexpensive and incredibly useful for shoulder health. If you do not have a band yet, you can practice the movement pattern without resistance to learn the technique. Sit in a sturdy chair with your back straight. Hold the resistance band in both hands with your arms extended straight out in front of you at shoulder height. Your hands should be about shoulder width apart on the band with light tension. Now, keeping your arms straight and at shoulder height, pull the band apart by moving your hands away from each other. As you do this, squeeze your shoulder blades together. At the end of the movement, the band should be close to your chest and your shoulder blades should be fully retracted. Hold this position for 2 seconds, then slowly return to the starting position with control. Do not let the band snap back. Control the return just as much as you control the pull. The critical detail here is keeping your shoulders down throughout the movement. Do not let them creep up toward your ears. The work should come entirely from between your shoulder blades, not from your upper traps or neck. Perform 12 to 15 repetitions. Rest for 30 seconds, then repeat for a second set. This exercise strengthens the middle trapezius and rhomboids, the muscles that counteract the constant forward pull on your shoulders. When these muscles are strong, they physically hold your shoulder blades in proper position throughout your daily activities, not just during exercise. Now we arrive at the fourth exercise, and this one is critical. If you take nothing else from this video, understand that this exercise addresses the most important mechanical factor in shoulder pain after 60. This is the rotator cuff. The rotator cuff is a group of 4 small muscles that wrap around the ball of your arm bone. Their job is to hold that ball perfectly centered in the socket during every movement you make. When these muscles are strong, the joint moves smoothly and without friction. When they weaken, the ball shifts slightly out of position with every reach, every lift, every rotation. This creates the impingement, catching, and grinding that causes so much pain. The good news is that the rotator cuff responds remarkably well to targeted strengthening. A 2020 study published in Clinical Rehabilitation followed adults over 60 with documented shoulder impingement. Those who performed rotator cuff strengthening exercises 3 times weekly for 8 weeks reported a 55% reduction in pain and significant improvement in overhead function. The researchers concluded that this type of exercise directly addresses the mechanical cause of impingement by keeping the arm bone centered where it belongs. Here is how to perform the exercise. You will need a light weight, such as a small dumbbell, a water bottle, or even a can of soup. You will also need a small rolled-up towel. Lie on your side on a bed or couch with your painful shoulder facing up. If both shoulders bother you, start with the one that is worse. Bend your top elbow to 90 degrees and tuck the rolled towel between your elbow and your side. This keeps your elbow in the correct position throughout the movement. Hold the weight in your top hand. Your forearm should start across your stomach. Now, using only the muscles in the back of your shoulder, slowly rotate your forearm upward toward the ceiling. Keep the elbow pinned against the towel and bent at 90 degrees. The only movement is the rotation at the shoulder. Rotate as far as you comfortably can. Hold for 2 seconds at the top, then lower slowly and with control back to the starting position. No momentum, no swinging. Pure rotator cuff activation. Perform 10 to 12 repetitions on the affected side. Rest briefly. Then repeat for 2 more sets. If you cannot tolerate any weight initially, start with no weight at all. The movement pattern itself begins to rebuild the muscles. And now we come to the 5th and final exercise. This one is different from the others because it combines everything we have worked on into one functional movement. Real life does not isolate muscles. When you reach into a cabinet, you are rotating and lifting at the same time. When you put on a jacket, you are extending and stabilizing simultaneously. This exercise trains your shoulder to handle those combined demands while keeping the rotator cuff engaged and protective. You will need your resistance band again. Anchor it low, either under your foot or attached to something stable near the floor. Stand with the anchor point on the opposite side of your working arm. Start with your hand near the opposite hip, thumb pointing downward. as if you are reaching across your body to grab a sword at your side. Now pull the band up and across your body in a diagonal line. As you lift, rotate your thumb toward the ceiling. You should finish with your arm elevated, thumb pointing outward, arm at about eye level or slightly higher. Hold at the top for 2 seconds, then lower slowly and with control back to the starting position. The slow lowering is just as important as the lifting. Perform 10 repetitions on each side. Rest briefly, then repeat for 2 to 3 sets. If you feel pain at the very top of the movement, reduce your range. Finish at eye level instead of going higher. As your rotator cuff strengthens and space returns to the shoulder, you will gradually be able to reach higher without discomfort. This exercise is powerful because it trains external rotation and shoulder elevation together in one smooth pattern. It mimics the movements you actually need in daily life, while reinforcing everything the previous exercises built. Now let me give you a simple daily routine that puts all of this together. Structure matters. Random exercise helps less than organized, consistent practice. In the morning, start with the doorway stretch. Perform all 3 positions, holding each for 30 seconds. This opens up the front of your body after a night of sleep and sets your shoulder position for the day ahead. Total time is about 3 minutes. In the evening, perform the 4 strengthening exercises in sequence. Start with the face-down arm raises for your lower trapezius. Then move to the band pull-aparts for your middle trapezius. Follow with the side-lying rotator cuff rotation. Finish with the diagonal sword raise for functional integration. 2 sets of each exercise. Total time is about 10 to 12 minutes. This routine addresses every mechanical component of shoulder pain. It lengthens what has become too tight. It strengthens what has become too weak. And it retrains the movement patterns that protect your joint during daily activities. Consistency matters far more than intensity. 10 minutes daily will produce better results than an hour once a week. The tissues adapt to regular stimulus, not occasional effort. Give this routine at least 4 to 6 weeks before expecting significant change. Some people notice improvement within days, others take longer, but the mechanical correction is happening whether you feel it immediately or not. Now I need to be clear about something important. These exercises support your shoulder health, but they are not a replacement for medical evaluation if you have a serious injury or condition. If you experience sharp pain that does not improve, weakness that prevents you from lifting your arm, or pain that wakes you repeatedly at night, speak with a qualified medical professional. There are conditions that require imaging, specific treatment, or in some cases surgical intervention. Do not ignore warning signs and do not stop any prescribed treatment without consulting your doctor. That said, the vast majority of shoulder pain in seniors is mechanical. It is caused by the postural shifts, muscle imbalances, and rotator cuff weakness that develop over decades. And mechanical problems respond to mechanical solutions. These 5 exercises address exactly that. Let me leave you with one clear takeaway. Your shoulder pain is probably not permanent damage. It is probably a joint that has lost its mechanical balance over time. The muscles that should hold it stable have weakened. The tissues that should be flexible have tightened. And the movement patterns that should protect it have been replaced by compensation and avoidance. You can reverse this, not with rest, not with medication alone, but with targeted, consistent work that gives your shoulder exactly what it needs to function properly again. Start today. Begin with the doorway stretch this evening. Add 1 strengthening exercise tomorrow. Build the full routine over the next week. And stay consistent for the next month. If you found this helpful and want more simple, practical health information designed specifically for your body after 60, subscribe to Dr. Kiara Walker Senior Health. I release new videos regularly that help you stay strong, capable, and independent as you age. Hit the subscribe button now so you do not miss what comes next. Thank you for watching. I will see you in the next one.